Good evening, everyone. Sorry, we're just waiting for a few more people to join. This is already 12 minutes. I don't know, maybe I'll probably, with the permission of the media team, probably like 3 more minutes, then I'll start, if that's okay.
Permission granted from the media team.
Good evening, everyone. I don't know if you can see my screen. Please, can you see my screen? Okay, okay. That's, okay. Thanks for the response. I saw your response. Okay, so I'll just go ahead and start. Okay, good evening, everyone. Sorry we're starting late. We had a little bit of challenges, and sorry I'm pulling you out on this Sunday evening. I'm supposed to be lounging and softing for the week. I still wish us all a happy new week. I must thank the media team for helping make this possible to have a discussion. The notification was not exactly as early as I would have wanted, but at least it's an opportunity for us to discuss something that I feel is quite important. So the discussion actually came up because on the 28th of July, we marked the World Hepatitis Day. Sorry, I won't be able to go back. I was just like, know if you can hear me. Maybe just someone can just unmute and let me know if you can hear me.
Yeah, we can hear you, and
Okay,
it's being streamed YouTube where it's being recorded, so you can carry on.
Okay, thank you very much. I appreciate that. All right, so on the 28th of July, we marked World Hepatitis Day. The reason why we hold it every day is because it's become a very big problem in the developing countries. It's not really much of a problem in the very developed countries because they've done a lot of things to make sure that it's prevented. And the reason why it's a problem in the developing countries is that using our generation, our age range, vaccination for children wasn't really part of our program in Nigeria until 2004, which means everybody on this page likely wasn't, okay, well, most of us on this page likely did not get vaccinated at birth, which now leaves it to the people that got vaccinated because at some point in their lives they were aware or they were told and then they got vaccinated. That's for hepatitis B. Hepatitis C does not have a vaccine, and then generally, just like you see for HIV, they show for face, which means people walk around hepatitis B or hepatitis C positive. So the awareness also became very important because hepatitis, well, the viral ones are the predominant cause of liver cancer. And I kid you not, in the last 1 or 2 years, I can tell you that I have lost over 20 people to liver cancer. And that's just me, not to talk of the other gastroenterologists that probably have managed the same, or hospitals where they didn't even get diagnosis in the first place. So hepatitis generally is an inflammation or swelling or damage to the liver. If you look at this image I have right now, it gives you a little picture of the digestive system. If you remember how biology was for us now, liver is the biggest structure inside the body. The Hausas will call it Hanta. If you go to Malam shop and ask for suya, of course they would likely add liver to it as well. So what we're hoping to learn today is to understand what hepatitis is and the types of hepatitis, then know how it spreads, recognize the importance of screening, learn prevention and methods of treatment, then to promote awareness within ourselves as a community, as Maduna University alumni, and in our small spaces where we work or we have exposures to other people, so that we can also play a role beyond just being friends and relatives, but also make sure that hepatitis doesn't become a problem in our environment. Just a little bit of an intro to tell you why the liver is important is that it performs over 500 vital functions, as it does a lot. Every single meal that you take in, that your body digests, plus alcohol, plus drugs, is digested in the intestines and then is passed through blood or through the veins to the liver for processing. The liver also produces bile. We all remember what bile is now. When you kill chicken when we're younger, or goat or ram during Salah, there's that greenish thing that if you should bust, the entire meat is bitter. That's actually bile, and it's what it does is it helps with digestion of almost a lot of the things that we eat, as well as a lot of other very important roles in the body. It helps fight infections as well, and then liver produces a lot of things that help you fight infections, including some what we call soldiers or antibodies, and then it stores vitamins like vitamin A, vitamin D. These are actually absorbed from fatty foods because of bile that comes in there. Then it supports blood clotting. Now, when you have an injury, when it's a small cut and you don't get to go to the hospital or dress it up, it eventually stops bleeding. That process that makes it stop bleeding, that you now have like a small plaque on top of it, that's called clotting. The liver is responsible for that function. So if the liver were not working, then that injury would actually not go. So what is hepatitis? Hepatitis simply means swelling, redness, pain in the liver. In medicine, if you talk to any of your doctors or your guys and they use anything that ends with itis, don't get confused. It just means that the thing is swollen and painful. For example, the white part of your eye. I think I've given this example before. It's called conjunctiva. When it's red and swollen, we call it conjunctivitis. The small organ, that small tissue that is like tube down in your stomach or your intestine, sorry, that they call appendix. When it's inflamed, we call it appendicitis. That's when you say you had appendix and they did the surgery for you. So hepatitis, hepa means liver, itis means it's red and swollen. Now, what that tells us now is that hepatitis itself is just damage to the liver. The question now is what is causing the hepatitis? That's where the rest of the story comes in. So the causes include infections. Now, recently, just a few days ago, I realized that when we use the word infection, people usually assume it means sexually transmitted infection. Please, infection just means that a microorganism has entered your body. I'll just put it that way. It could be a virus that entered. It could be a parasite. It could be a fungus that's like yeast. It could be bacteria. Any of them can form infection, and it can be any part of your body. So infections like viruses can affect the liver, in which term we'll call it viral hepatitis. But there are some specific viruses that they are so important to the liver that we label them hepatitis viruses. So these are hepatitis A, hepatitis B, hepatitis C, and hepatitis D, and E as well. These viruses cause viral hepatitis. What that means is there's also some other viruses like CMV. We don't need to go into that one. Herpes, we're all aware of herpes now, can also affect the liver. Some bacteria can also affect the liver. If you remember our secondary school days when they talk about amoeba, and amoeba histolytica, all those big names can also affect the liver. Something like schistosoma that causes uh, bleeding from urine can also eventually affect the liver. Alcohol is a cause of hepatitis. I'm not trying to ginger everyone, but it's just very important that we know that as well. However, it's not the only cause of hepatitis. Alcohol can cause hepatitis commonly in large quantities. Drugs, for example, one of the commonest drugs that could affect our liver is paracetamol. Paracetamol is the commonest drug that causes acute liver failure and shutdown. Certain toxins, people like to eat a lot of granite. When you see mold on it, they are called aflatoxins, or dry fish that has mold on it, or tomatoes that has mold on it. The mold itself can affect the liver and actually even put you at risk of liver cancer. Herbal concussions. Like if you've ever listened to me talk before, something I usually tell people is that I don't have a problem with herbal concussions. I have a problem with the processing, with not being aware of the doses, the strength, what it contains, the different compounds inside it. Is the mixtures I have big problems with. If you tell me, oh, I had tea, maybe hibiscus tea, zobo, I won't fight with you. By the time you mix zobo with soursop leaf and guava leaf and pawpaw leaf, I don't know that you're mixing bomb. And like I always say, whoever is giving you that thing is not going to be there to account for damages that might occur. It's going to be a hospital you come to. There are even some orthodox drugs that we give, the paracetamol, like I mentioned, certain drugs like fluconazole for yeast infection can also cause hepatitis. So we tend to be quite careful. Even drugs for cholesterol reduction, like statins, for those of us who may be hypertensive or know people who are hypertensive, you hear drugs like rosuvastatin, atorvastatin may also cause some level of hepatitis. Now, this doesn't mean that these drugs should not be taken. It's just that when they get taken, we should be aware that these side effects can occur and adjust doses as necessary. So the viral hepatitis is the major reason why we're having this discussion. The reason why it is that the viral hepatitis are commonly spread through ways that may be preventable, so that if we have a better understanding of how these things are spread, we may be able to protect ourselves and have a better life ahead. So the viral hepatitis are hepatitis A, B, C, D, and E. Now, just like I mentioned when we were starting, unfortunately, even more steep. Every 30 seconds, somebody dies from hepatitis related illnesses. Millions are living with hepatitis without knowing it. In Nigeria, we have an 8%, 8 to 10% prevalence. If you're working with a population of 200 million people, we're thinking 20 million people, give or take, have hepatitis. And a lot of these people, and even more, are not aware. Prevention, okay, so even the millions are living without knowing it. Prevention, early detection, and treatment save lives. Just a map of the world, the parts that is deep purple are the ones that have greater than 8% population. If you look there, you're going to see your Nigeria there staring at you boldly. Nigeria. Now, this is the same world map. It's actually giving you the deep green is also where the population is high, and then there's Nigeria there. Now, let me just throw in some other words that people commonly confuse. In medicine, we use words like acute and chronic. I met a patient on Thursday, that said her own husband's headache was acute. No, it was chronic. And I asked what chronic meant. He said that the headache is very severe. It hits the head very well. I said, okay. Chronic simply means that something has been there for a very long time. It has nothing to do with how severe it is or how mild it is. Acute, on the other hand, is something that's been there for a very short period or will be there for just a short period. Now, usually a lot of acute conditions might appear quite obvious, while chronic conditions might just be very quiet or indolent commonly. So for liver disease, we define acute as something less than 6 months. So an acute hepatitis is the kind of hepatitis one would have, and within 6 months will resolve on its own. For example, if somebody gets infected with hepatitis A, hepatitis E, or in some cases hepatitis B as an adult, without us doing anything, the body will likely clear it on its own within 6 months. So we refer to them as acute hepatitis. Chronic, on the other hand, they are the ones that will likely be there for a lifetime. Hepatitis C likely is like that. If you get hepatitis B as a child, likely to present and stay for the rest of the person's life and continuously keep causing damage. So acute viral hepatitis usually doesn't require hospitalization. It's just symptomatic care. Give pain medicines, hydrate the person properly, and then try to avoid all the toxins. Usually they will be fine. Within 6 months, they're usually better. Death rarely occurs, usually less than 1%. Chronic is where we have a big problem because that is the one that will be very quiet, will not show on the face, will eventually result in liver failure, result in liver cancer. The ones that cause this predominantly are hepatitis B and hepatitis C. That's why they're the most popular hepatitis because once they are there, they're likely going to be there for a long time. So how does hepatitis spread? I'm talking about this one specifically because um, I did a little outreach recently in Gariki, and I asked whether they would tell people if they had hepatitis, and nobody agreed that they would tell someone, which means that stigma is one of the biggest problems when it comes to hepatitis or infectious diseases. And the reason for this is a lot of people believe that it's because you're promiscuous or you did something bad that you're having hepatitis. It's not entirely true. So hepatitis is gotten through blood and body fluids. Now, blood means sharing of sharp objects, tattoo parlors, blood transfusions when blood is not properly screened, sharing of clippers, sharing of needles, toothbrushes. Now, toothbrushes normally will not be harmful, but then most people, when you brush, there's some blood stain that comes in. Somebody uses that toothbrush later, it will still transmit that virus if he also has a blood stain from mother to child. If a mother is positive for hepatitis B and they are not aware, the proper measures are not taken to protect the child, chance of transmission is there. I already mentioned unsafe injections, sharing razors, clippers. Unsafe sex is there. However, it's not the predominant cause. I say this because commonly I see lots of patients who have hepatitis, yes, and their spouses are very fine. Unprotected sex, they're having children. Now, this is not me giving permission to have unprotected sexual intercourse, but then I think that the risk is higher amongst homosexuals because of the poor lubrication. It's also higher amongst non-consensual sexual intercourse, where the risk of bruises are actually higher. Then for hepatitis A and hepatitis E, they are spread through contaminated food and water. In other words, not washing hand itself is a mode of contacting hepatitis A and E. So imagine such a person now not telling people because he's scared that they will think that he was promiscuous. That's not fair. And that also causes a risk of progression of disease to more severe forms. I've talked about this already. So these are just images of how hepatitis B and C can be transmitted. If you look at the toothbrush is there as well because of the bruises that can be caused. You can see the piercings that this beautiful, I want to assume it's a lady, the one with the piercings has. Then you can see the person trying to inject needles. You know, when people tend to be hooked on injectable drugs, once they need that surge at that point, they don't care the source of how they're going to get it. You can share needles and get infected. Hepatitis is not spread through handshakes. It's not spread through hugs. It's not spread by sharing meals or classrooms. It's not shared by working with infected persons. Now, I say this because if these were the ways, then I would not have a clinic to run because I attend to people that have hepatitis every day. I shake them when they come in. We gist before I start talking to find out what is wrong. I don't start wearing hand gloves before I shake them. So it's not proper to make people feel like they are plagues and like they can't have any form of support. So reducing stigma begins with understanding these facts so that we don't hear that someone has hepatitis and then marriage is called off. Well, let me not. I think that's a decision that you actually have to make when the person is more, you're more knowledgeable about it, and it's not a reason to not give people jobs, except you think that the risk of transmission is high, like if blood contact and blood exposures are going to be there. So this stigma is really a problem that needs to be addressed. I say this because a lot of us have businesses as well, and then if you're going to check, let that not be a defining factor for whether or not you're going to give the person a job. So just a little thing now, if people get hepatitis in childhood, like I mentioned earlier, they usually will likely progress and have it as chronic hepatitis later. But if you get it as an adult, in over 90% of cases, your body will clear it without even you having to see me. You might just think you had malaria or a fever, and then eventually your eyes become yellow, and then you get well after that, and you're done. And when you get hepatitis B like that, you're protected for life. Now, why is it called a silent killer? Many people do not have any symptoms. They don't have it for years. In fact, let me give you a scenario that I face. I once saw a patient. He was 24 years old, if I remember very well. He was in camp and was having abdominal pains. They said it was ulcer, gave some medications, nothing. Then they brought him to the hospital. They did a test at the emergency. I was hepatitis B positive. The moment they told me, 24-year-old guy, hepatitis B positive, abdominal pains. I was like, I hope it's not the pain that brought him to the hospital. They said it was the pain. In my heart, I knew the guy had less than 6 months to live. Now, why do I say this? If it gets to the point where you come to the hospital of abdominal pains, it's likely that you already have liver cancer and the cancer has already spread. That is how bad it is. In fact, I did a little bit of a study, a survey in 2022. I looked at all the liver cancers we picked over the period, and I realized that over 80% of them were caused by hepatitis B or hepatitis C. And of this 80%, less than 10% knew about hepatitis before then. In fact, the moment they found out they had hepatitis was when they already told them they had cancers, and it was already too late. As of today, there's nobody that was in that survey that is still alive. And the oldest person in that survey was 45 years old. That's how bad it is. The person is very fine. One day there's abdominal pain, it's too late. So the best way is early review, screening, and management. So symptoms often appear after serious complications have already developed. So if you look at the images, these images are not internet images. These are images from the hospital, people that I have seen. The upper image to the left is someone that has a liver cancer. You can see a big swelling localized at one part of the tummy there. The other three images are people that had chronic liver failure, where we call it cirrhosis. That now cause you can see how dilated, how distended those veins are in the tummy because of a buildup of pressure. The reason the tummy is swollen like that generally, that there's a lot of water inside it. We call it ascites. They also had swelling in their feet, swelling in their legs. Their faces were a little bit puffy. Their hair was already beginning to fall out or become very thin. Yeah, for the women, for the lady in that image, her breast was already shrunken. For the men, they were beginning to develop breasts. So this is how bad a lot of these things can be. So who should be screened? Now, when we use the word screening, screening means it's a test you do for a condition that you don't have. The goal is to make sure that it's not there. If it's there, to make sure you catch it early enough. The purpose of screening is that the person is healthy, the person is not sick. So pregnant women, anybody going for antenatal must be screened because if you have hepatitis, there's a chance of moving it or transferring it to the child. Healthcare workers, that's for us. And any of us, any of you here now who has any link with healthcare, even if you're a businessman that does IT for a hospital, you're a supplier, as long as you get into the healthcare facility, you should be vaccinated. Household contacts of infected persons. So anybody that is tested positive, everybody should be screened. Anybody exposed to blood product, maybe you had some injury, some accident that you need to be transfused, or you're a sickle cell disease patient, or you have any blood challenges. If you're exposed at all, you must be screened because blood is one of the primary modes of transmission. Then, if you've never been tested before, please do get tested. The warning signs we don't want you to have. Fatigue is this profound weakness, loss of appetite. Jaundice is when your eyes start getting yellow. If your tummy starts swelling up unnecessarily, not from over enjoyment. I mean, you know when it starts swelling up and it's not normal. If you're losing weight and you're not intending to lose weight, and no matter what you're doing, the weight is still going, you must be screened. And these are warning signs that things are actually already getting bad. Then upper abdominal pain, like in the image I showed you earlier. So acute, like I said, you can have features like malaria, vomiting, feeling weak. Your stool might be a little bit dark or pale. You have headaches. Basically, it will appear like you have malaria. But like I said, as an adult, if you get it, usually your body will clear it in most cases. This is someone who is already having the chronic form. Chronic means it's been there for a long time. The muscles are wasting, the body is beginning to shrink, the tummy is getting swollen with water, and then the palms are getting red. If you look at the liver there, you can see that the one down is looking like he has a lot of pimples everywhere. We call that on a cirrhotic liver. Chronic hepatitis, not a show for face. Everything we're talking about is just inside. The liver is like a good wife to a bad husband. What I mean by this statement, forgive my analogy, is that no matter how terrible the man is and what he's doing, the woman just applies makeup and she just tries to cover, make it seem as though everything is fine. The day you see her screaming, you will be wrong to make the mistake to assume that the problem just started. That's why when a patient comes to me with abdominal pains and they say he has hepatitis, what I think first is cancer. In fact, I'm always very happy if by chance I do not see cancer because that's usually how it is. The liver has the ability to tolerate till it's too bad. So liver will not show any signs until over 90% of the liver is gone, which is too late. Complications, if you don't get this hepatitis properly treated, it can begin to shrink and lose its function. And once it loses its function, you start having all those things I mentioned earlier, the body swelling and all. And then you can also develop cancer and, of course, premature death. So if you look at the image, to the left is just when there's small cirrhosis or the hepatitis has been there for a while. In the middle is not you don't have cirrhosis, and to the right you have cancer. That's basically the pathway. It's one, and then during this period you will actually be fine. That's what makes it very painful. So how do we prevent this? As Madonna University alumni, we need to get vaccinated against hepatitis B. During the penultimate meeting that we had, we did screening for hepatitis B, and lucky for us, most of us were hepatitis B negative. So what I'm going to say in addition to that now is, if since you were most of you were negative, if you've not been vaccinated, please go and get vaccinated. There is no vaccine for hepatitis C, unfortunately, so please do not share sharp objects. Get your own clippers. Practice safer behaviors. If you have multiple sexual partners, I will advise you limit that as much as possible. Demand safe healthcare. Now, this one is not putting the blame on everybody, putting blame on the healthcare workers. If you see a healthcare worker picking a needle that you did not see him uncapping in front of you, please do not use it. If you see him pick a needle from the ground, do not accept it. No thing, nothing sharp should be used on you that you do not see them opening or tearing open at that point. A lot of people tend to want to be stingy and mice things. Please do not accept it. I did my NYC in Oyo State, Irua. Some people were trying to make money. When I was done repairs, suturing wound, maybe a patient comes with an injury, I repair it. The remaining thread, while I'm trying to clean up the patient, I realized that someone has taken the thread. I didn't take note of it initially. I felt that maybe they were helping me dispose of it. And then I found out that they were keeping those needles and the threads and using them to suture other people when I was not around so that they could make money for themselves. It's shameful, but unfortunately, it happens. So what I started doing was I will cut the thread at the point of the needle, discard the needle myself as I'm finishing right there. That's what I could do, but that's the only place that I worked. But you don't know what else could happen anywhere. So you cannot be a Madonna University alumnus and then you have an injury and somebody brings out one needle that you did not see where they open. My dear, please do not agree. Let it be that they open it fresh in front of you. And whatever they're using to hold the needle should be fresh as well, properly sterilized, not one that they use for five other people. Or someone coming to meet you in an emergency, had wearing gloves that they used to attend to somebody else. People can be careless. So please, I'm saying watch out for these things when you're in the hospital. Then educate your family and community. So this is just an outing we had on the 24th, sorry, on the 28th. I'm part of an organization called Enlightenment Initiative on Viral Hepatitis. So it's part of our responsibility to give as much information as possible. So this screen is usually done with simple blood tests. And please let us be very aware, hepatitis B can be managed. It doesn't necessarily have a cure, at least for now, but it can be managed. Hepatitis C has a cure. So not everybody needs to be on medications. Even if you have hepatitis B, your doctor is going to evaluate you properly and see if you need to be on medications. If you're not going to be on medications, you'll still be followed up because that decision could change. If you're on medications, you'll still be followed up because there could be reason to change those medications or detect cancer early in case it's coming. And whichever one that it is, whether it's hepatitis B or hepatitis C, follow up must be, even though we know it's curable for hepatitis C, you must have a regular follow-ups, because after having hepatitis C and getting cured, you could have hepatitis C again. And then if you catch hepatitis C at a point where it has already caused damage to the liver, that damage could still progress. So the follow-up is very important. One of the biggest issues I've had is a few people were told they had hepatitis B or C. Unfortunately, they got the wrong information where they were told, oh, there was nothing to worry about. It was just an inactive one, and they left it and forgot about it. And next time I saw them, they were having cancer or they already had a spread. So there are vaccines available for hepatitis B, but there's no vaccine yet for hepatitis C. Um, Please, it's important to, okay, I think we talked about this one already. I need to edit these slides. Hepatitis B vaccine was eventually referred to as the first anti-cancer vaccine because hepatitis B is recognizable to cause cancer. And just like I mentioned, the National Program for Immunization added hepatitis B vaccine in 2004. So all of us that were born before 2004 were not vaccinated. So please, if you've not gotten it as an adult, go and get it, and it offers what 95% protection. So what are the few myths that I've heard over the years? I think when the slide was being shared, it said, I don't take alcohol, I cannot have hepatitis. That's definitely not true. Alcohol is not the only cause. I'm sure we are now all aware that it's not only alcohol. And so I once heard someone say it is only unfaithful people that have hepatitis. That's also not true. But this can come from any other modes, and sharing sharp objects even has a higher chance than being unfaithful. That is not me encouraging being unfaithful. Then that most people that hepatitis always shows on the face. That is not true. Like I mentioned, most people have no symptoms. Sugar cures hepatitis. Again, that is not true. I've had a lot of patients come to me and tell me that they saw someone, the person said they should be taking a lot of sugar cane. Please, that's not true. Hepatitis A and E, mainly symptomatic. Hepatitis B, C, and D, they can be treated with medications. Hepatitis C has a cure. Other misinformation that I've heard: do not eat protein. Also not true. You actually should eat very healthy. You need all the nutrients possible to handle what you're going through. Do not eat meat. Also not true. Also not true. Please eat your meat. You don't even eat as much meat as people eat during Thanksgiving in other countries. Please eat. Don't eat palm oil. No, please take your normal healthy amounts of the right kinds of oil, because oil itself in excess can cause another condition called fatty liver. So you're not avoiding oil just because of hepatitis, but because in itself it may not be healthy. Take lots of sugar cane. I think we've addressed that already. That's not going to do anything. So please, as Madonna University alumni, I don't intend to take so much of your time. I was hoping to make like a 15-minute presentation. Let's raise awareness. Let's, as much as possible, try to get vaccinated. Let us reduce the stigma. Hepatitis B or C is not a death sentence. There's hepatitis A, D, and E as well. And we need as much support as possible when these things happen. I am a gastroenterologist. There are about 10 gastroenterologists in the FCT who you can see. If you think because I'm an alumnus, you don't want to see me, that is also very fine. There are 9 others in the FCT that you can see if you're tested positive for hepatitis. You can walk up to any primary healthcare center or hospital and ask for a vaccine. You'll be asked to do a test for hepatitis B. If it's negative, which I hope it is, you can get vaccinated. There are 3 doses, one at 0, 1, and 6 months. That's how it's usually given. But there's an expedited dose in case you need to travel, where you can get at 0 and 1 month. They are all very readily available, and they are not too pricey. I don't think there's any vaccine more than 2K or 3K, but I'll find out. So let's promote vaccination. Let's support community screening. Let's engage schools, or I'm doing that already, and alumni, faith groups, NGOs as well to do that. Hepatitis B can be treated with drugs, like I mentioned. Hepatitis C also can be treated with drugs. For now, yes, very important that I state this. For now, we must know that if we do start you on drugs for hepatitis B, it's lifelong for now. Hopefully, in the next few years, that will not be the story. Maybe newer things will be available by then. But for now, if there's a need to start you on drugs for hepatitis B, it's for life. Hepatitis C, on the other hand, is for about 12 weeks. That's 3 months. Usually, they will now do a test again to confirm that it's been cured before they can let you go. So, what can you do today? Know your status. Please, it's very important. And lucky for us, a lot of us already do. Those that came for the meeting the last time. If you've not started, start your vaccination for hepatitis B. If you have, complete your vaccination. Encourage your loved ones to get screened. Share accurate information and support people living with hepatitis. So the key takeaway from here, hepatitis is preventable. Early detection is what is going to save. And well, just let me not discourage. Late detection, it depends on what happens. You can also get a liver transplant, but for now, not within Nigeria. Vaccination works, treatment is available, community action will change lives. So let's stay connected. Hopefully, as part of the alumni program, we'll have further discussions. I'm hoping that we can throw more light on other things that can be manageable. Thank you all very much for giving me your time this evening. Let's take questions and comments. I still on?
Yes, you are. Can still hear
Okay.
you.
Thank you very much. So I'll appreciate any questions, any clarity, anything we would like to address.
So I think there's some questions in the comment section.
Oh,
In
okay,
the chat section.
yes. Thank you very much. I appreciate this. Okay, I'll just read it. Said, okay, wow, this is crazy now, but that's what we more. So, how can one be vaccinated against hepatitis B and still be said not to have generated immunity against the virus? That's a very beautiful question, Mr. Cyril. So, let me explain something this way. Sorry, I'm going to use examples. Let's assume that Randy is a bandit. Yeah, Novex, I had to use that example. And Randy runs into, no, Randy is not a bandit, pretending to be a bandit. And then Randy runs into our alumni meeting with an AK-47 mask covering his face, and then he releases some blank bullets in the air. And then a lot of us are going to panic. True. Then maybe he runs away, but he doesn't kill anybody. But if that happens and we're certain that he's not Randy, or we're not sure that he's Randy, if we're going to have another meeting, a lot of people might not come, but some will come, but they will come armed. The reason is it don't happen before. So if it happen again, that is actually how immunization works. Immunization takes a chunk of a virus or an organism, let me put it that way, and exposes you to it. In this case, Randy, who is not a bandit, coming in with blank bullets. Your body is supposed to now produce a response. If your body does not produce that response, you may have been vaccinated, but you have not been immunized. I don't know if that makes sense in any way. So in saner climes where there's more information, when you're done taking this vaccine, if you're going to get exposed to a high risk environment, we go and do a test to check if you raised if you raise that appropriate immunity. And there's a level that we use as we say is protective. We say we call it the surface antibody. We say the surface antibody greater than 10 is protective. For me, who is a health worker, who is a gastroenterologist, I do check my titers periodically just to be certain that I'm still protected. Sorry. I don't know if you can still hear me. For me, who is a health worker, I do check periodically just to be sure I'm still protected. A lot of people, this information is not exactly there. So it's possible to get exposed to the vaccine, but not get immunized. And some of the commonest causes are, let's do proper scientific causes. If you're probably poorly nourished, if you are immunocompromised, what I mean by immunocompromised, maybe something that suppresses your immunity, maybe you're diabetic, maybe you have maybe HIV, you're on anti-cancer medications. This is going to dampen your immunity so you don't produce the amount of response that will be needed. But there are system problems. For example, the vaccine may not be as potent as it's supposed to be. There's what we call a cold chain where the vaccine is supposed to maintain a certain temperature all through from production to when it's administered. Unfortunately, in the country that we live in, we have power problems. We have credibility problems. People can only tell you by mouth, yes, it was thawed, it was frozen all through, but we can't really tell. So because of that, we can't vouch for the value or the quality of the vaccine that we're taking. So these are reasons why one could get vaccinated or immunized, vaccinated, and not get immunized. That's just what I'm trying to explain. So you said I'm hoping that was clear. I'm hoping. Okay. Okay. You said, from what you said about hepatitis B not being transmitted through heterosexual intercourse, does this go to mean that the virus is only harbored in the blood and can only be transmitted through coming? the fluid. No, I didn't say it cannot be transmitted. I said the risk of transmission through normal sexual intercourse, that's heterosexual, is not as high as is preached. Usually, blood contact plays a bigger role. I have had people who've been together for years, Hep B positive, and they were fine. Now, it doesn't mean it cannot happen. What we do is that if your partner is positive, remember I said if your family members or someone who is positive, you must be screened. Once you screen, you get vaccinated. We still take the measures. It can be transmitted. It's just that it's not as commonly transmitted as is preached, and that is what causes the stigma. Everybody now assumes that once you have hepatitis B positive, it's through sexual intercourse. It's not entirely so. So yes, it can be transmitted. Is liver function test alone sufficient for routine checkup for liver, or should liver scan be needed too? Thank you very much. Liver function test alone is not sufficient. When you see a car packed, a scan is like looking at the car, admiring the car. But you cannot tell if it's working fine until you start it. Now, that is where the liver function test comes in, which means that you can start the car starts and moves, it means the car is fine. But what if the car has a dent? Then that's where the scan comes. So there are a lot of things we'll do. We do a liver function test. We do a scan. We do a viral load. That's the amount of viruses that are available, because that's going to help us tell whether whatever you're doing is going well, or whether the virus is multiplying, whether it's actually well suppressed. We'll do a kidney function test, because at times some of the drugs can play a role in affecting your kidneys. And at times, the hepatitis B or C can also affect the kidneys. Was we do what we call an alpha fetoprotein. That one actually tries to assess whether there are already small tumors that your scan may not have seen. So we screen periodically for cancer as well. And then you also examine the person generally, see how the person is doing. Be sure that the liver is not failing gradually. So what are the early symptoms of hepatitis B? Now, if you say early, we mean that if you are just getting it as an adult, you may have what we call the acute hepatitis, which may present like just malaria. Let me put it that way. Fever, headaches, weakness, but usually it will resolve. Your eyes might become yellow and feel clear. I'm using the word early simply because we're likening it to as at when you just got it. But if you get it as a child, you likely will not have any symptoms at all, and you grow down up to have hepatitis. Now, for chronic hepatitis, I don't even want you to have symptoms, because if it's now chronic, if you have symptoms, it don't bad, because it means that the liver is no longer able to handle it. And we're now talking of abdominal pains, weight loss, your eyes getting yellow again, body swelling, pain in your upper part of your abdomen. These are now features that the liver is failing, or you're beginning to develop cancer. What recent advances in hepatitis treatment or prevention are you most excited about? Well, I will start with prevention, because as at 2004, that's when we started having the vaccine for children. Then now we are actually always eager to do a lot of health awareness and screening. Now, with regards to treatments, we are beginning to get to a phase where we are achieving cure for hepatitis B. Almost every day something new is coming out. About 2 years ago, we had Zanesiran, and then right now we're having more discussions with hepatitis B treatment. Before now, we had injections, which were like once a week, but now we use oral medications, which give some assurance that you're not going to build resistance to it. So I think, since the question says most excited, I think it's the possibility of a cure coming up, because that's our most recent discourse for hepatitis B. For hepatitis C, it's great because we already have a cure. It's because we define that by the absence of the viral load. And then the other forms of hepatitis, a lot of them are actually self-limiting, and well, they're actually easier to manage. Thank you very much for that question. So, is it advisable for one to have this vaccine taken repeatedly, since there is no way of ascertaining the potency of the vaccine given in the country? Or is there a way of confirming the potency of the vaccine? Now, yes. There are ways. There's a test called hepatitis B panel. What it does is it tells whether you've built antibodies to it. In SENA, sorry, I take back that word SENA climes. In climes where access to healthcare is not constrained by finances, ideally, you don't just do the hepatitis B surface antigen for a screen. You do a panel, which is the core antibody and the surface antigen. What this does for us is that It tells us if you've been exposed at any point in the past or recently to hepatitis B. And the core antibody tells you or tells us about the exposure. Then the surface antibody tells us that you've been immunized. So if the surface antibody is negative, you have not been immunized. You may have been vaccinated, but you've not been immunized. It's actually easy to do. That one is not too expensive. So maybe I will recommend that for those of us that have been immunized before, just to see what their status is like. Yes, for the first part of the question, taking vaccines repeatedly, not necessarily. The vaccine, when it's taken properly and you're covered, should cover you for about 25 to 30 years. So that should be good. Is any of the hepatitis transmitted through saliva? Not, I can't say a clear no. The reason is that I gave an example with toothbrush, and I talked about the fact that when you brush your teeth, you could have some gum bleeds, and those bleeds can be transmitted when somebody shares the same toothbrush if he still has bleeds later. Now, the reason for this is that, beautiful, thanks for asking this question. HIV cannot stay inert, as in on a normal surface, for more than a day. A few hours and it's inactive. Hepatitis B can stay for as long as 5-6 days, which means that toothbrush that has that blood stain can still have hepatitis for a while, and then someone else can get it from there. Thank you. Can the hepatitis B routine test? So, if your question about saliva was through kissing, we don't have results from that actually. We don't have records of that. Can the hepatitis B routine test result conflict with that of the HBV panel test result? Ideally, it shouldn't. Ideally, it shouldn't. Because the HBV panel is a more exhaustive test that also includes the hepatitis B routine test result. Because what the first component of the panel is the hepatitis B surface antigen, which is the routine test. But now, the reason why I didn't want to give you a straight yes or a no is that I had a patient recently who was tested positive for hepatitis B before he traveled, and then came back a few months later, did a repeat hepatitis B test, and it was negative. He came in and started throwing tantrums that the labs were giving conflicting results. So I asked him to do a panel. He did a panel. It showed that he actually did have hepatitis B. His body had cleared it, and he had now been immunized against it. So basically, what he had was hepatitis B, and then the body cleared it. The samples were just taken at two different times of this whole process, and that's what caused the misunderstanding at the time. Thank you. I don't know if there are other questions.
Maybe I can just voice out this other question. So I know you said there are other ways for hepatitis to be developed in a person apart from the viral means.
Yes.
So this means that the vaccine only gives coverage for the viral cause of hepatitis and not the non-viral cause of hepatitis, correct?
Thank you very much. I appreciate that. Yes. Now, not even more specifically, only for hepatitis B. And then we also have a vaccine for A, and then I think E is being developed. But now the vaccines are not available for C and the non-viral causes. Yes, I agree. Thanks so much for helping me make that very clear. In other words, apart from all these things, a healthy life is still very important. Reducing alcohol intake is also very important. Exercising is very important. Reducing intake of herbal concoctions is also very important. Avoiding non-prescription medications, obviously drugs without prescription. I take that. Yes, very important. Any other questions? I think I should thank everyone for coming out. I really appreciate the questions. I appreciate the interest. I appreciate the participation today. At least I'm hoping that we'll be able to pick one or two stuff. So I had to drag people out on a beautiful Sunday evening to talk health. But I want all of us to be healthy. I must appreciate. Oh, beautiful. I can see this. Beautiful question. Can a person who has recovered from hepatitis B or C become infected again? Beautiful. Now, for hepatitis B, if you recover from it and you have a functional cure, you're protected for life. So those people that have acute hepatitis B and recover and now test negative, they are fine for life. Hepatitis C, on the other hand, they still stand a chance of getting it. In fact, for hepatitis C, if you do the routine screen, you might still test positive because the screen that you do does not really test for the presence of the virus, just the fact that you were exposed and your body produced soldiers to the hepatitis C. So what you now do periodically is do viral load to check and be sure that you don't be reinfected and then live a very healthy life afterwards. What's the relationship between hepatitis and liver cancer? Hepatitis B and hepatitis C are the foremost or the leading causes of liver cancer. Once you have it, chance of cancer exists. Hepatitis B is not curable, which means once you have it, whether you're taking drugs or you're not taking drugs, I must check you periodically to make sure that you don't have cancer. Or if you do have cancer, I catch it early enough to make sure I remove it. I recently had a man in his 50s who I caught the cancer very early. We did a surgery, yanked it off, and he's very fine right now. We're just treating the hepatitis B. Hepatitis C can, like I said, is curable, but must also check to see how much damage it costs before we cure it. Because if you already caused a lot of damage to the liver, that damage can progress and still go and cause cancer later, even when you remove the hepatitis C that caused the damage. I don't know if that makes sense. Then are green teas safe for consumption? I'm a little bit careful with this because if you talk about lemon tea, Lipton, I don't have a problem with those. But when you start combining lots of things that are all labeled green tea, I start to have a problem. So I think what really matters is the content of the green tea rather than just the umbrella term green tea. Okay, I think this answered this. Okay, the question just came a second time, the one for hepatitis B and hepatitis C. Thank you very much for all of your questions. Thank you very much.
Concerning, sorry to drag you back. Concerning the what you said about the green tea, you said
Yes.
what problem you would have would be the ingredients of the green tea. Are they certain ingredients you would point out as ingredients we should look out for as red flags or ingredients we should be okay with?
Now, generally, anything that contains aflatoxins in any color. Now, we use word aflatoxins to mean fungal, is a form of fungal content. A lot of people tend to dry a lot of these leaves and they develop molds and then they form the tea. So, like I said, it's not really the tea I have a problem with, it's the content, what they're processed with. If you're getting something like Lipton, I don't have a problem with that. But if you're mixing lemongrass, drying it in your house, eventually becomes brown and all, then I have a problem with a lot of all those ones. But green tea, in the true sense of the word green tea, I don't have a problem with it. Thank you. More questions? Once again, I must appreciate everybody. I must appreciate the questions. Honestly, I'm actually very excited about it. Okay, it's 05 right now. I don't know if the media have any remarks. Okay, I think I must thank you all once again for your participation, for your time. I'm hoping that we'll have more discussions, probably even go deeper into some of these things subsequently. I will also communicate with the medical team for what our next plan is and when we're going to meet again. Uh, in the absence of other questions. Oh, sorry. Okay, okay. Thank you very much. I truly appreciate everyone. The
Thank
absence of other questions. How can pregnant women have the ability? Oh, beautiful. I think I would like to address this before I go. So, pregnant women, like I mentioned, pregnant women must be screened during antenatal, and the reason is to confirm that there's hepatitis B. Once there's hepatitis B, we usually do a follow-up. If they are on drugs already, they just continue. That reduces the chance of transmission. If they are not on medications, by the time they are getting to their third trimester, which is from 28 weeks of pregnancy, that's about 7 months of pregnancy, we'll do a viral load. If that viral load is high, we'll start them on medications, which is just for that period of till delivery and a few weeks afterwards. And then the baby, we'll get an injection called immunoglobulin. It's like raw antibodies. Let me put it that raw soldiers, fresh soldiers put into the baby so that any one that mistakenly crosses the mother to the baby is cleared out. And then the baby gets vaccinated. So that's what we do. And it reduces the risk by over 90%, over 99% self. And I don't think I've recorded anybody so far that we managed in pregnancy that the child came down positive with hepatitis B. And then the child also gets the full spectrum of immunization for every normal child. Thank you. All right. Thank you all, everyone. It was nice having this session with you guys. I need to go for another lecture right now. I wish you all an amazing week. Good night, everyone.
Good night, Doug. Thank you so much.
All right, good night. Thank you, Doc. Thank you so much for this.